Honourable Member Barbara Stewart.
Thank you, Mr. Chair. Thank you, Mr. Chair. I'm very pleased to take a call on behalf of New Zealand First in the Appropriation 2014-15 Estimates Bill. Each year in the health budget, we anticipate a estimate budget that might focus on some preventative health measures. In this House, we all know that prevention is far better than cure. We need that vision. We know that the health budget is reducing in real terms year on year, and the Honourable Annette King also spelt that out very clearly. So spending on prevention is logical. It will work towards preventing an increasing burden on our already strained health budget. Yet these estimates hold very few thoughts for preventative strategies, which is a shame. We were expecting this. Why aren't there any plans? We know there's an obesity and diabetes tsunami actually coming to our country, just about upon us, I would say. But we must praise the government in one area, and that was for the free doctors' visits for under 13s. That is a preventative measure, and we're very pleased that National was looking at New Zealand First policy and starting to implement some of our health policy. We would also have liked to see in the estimates an attempt to reduce the hospital waiting lists, perhaps additional staff to help out. We see the media highlighting the plight of people who require surgery, but they don't qualify for the waiting lists. Effectively, they are waiting to get on the waiting list. And every member of this House would receive letters from people saying they have been waiting months and some even years. And in the end, they have to revert to living with pain, borrowing money to pay for the surgery that they need, or some are lucky enough to go to a charity hospital to get the operation that they need. It's really disheartening that the government has set a test for the level of need for surgery when clearly many thousands of people are actually left off the waiting list, and yet they are in dire need. The people who don't win this game of roulette often end up loaded up with painkillers and other drugs that they need. While they're waiting to go on the waiting list, their health will deteriorate and their quality of life will be compromised. By the time they finally get to have the surgery, the toll on the health system's dollars will be vastly more than if the surgery had been done earlier or when it was initially dated for them to have it. The number of people waiting to get on the waiting lists is a ticking time bomb, and it really requires urgent action by the Minister of Health. The sad part of this is that nobody really knows the extent of this hidden list. Even the medical profession is speaking out and questioning the management of the health system, pointing out that there is a hidden waiting list and saying that doctors themselves are very frustrated by the constraints imposed by the government's targets, looking at outputs rather than outcomes. This is a problem that disproportionately affects seniors, which is particularly concerning given that we have an ageing population here in New Zealand. In New Zealand First, we would rather see an ailment checked out with a GP at an early stage before hospitalisation becomes necessary. It is far less expensive. The rising costs associated with this costlier health care will drive the DHB's books persistently into the red unless further action and fiscally neutral health plans are actually actioned. We know this is going to happen. We have all the evidence, and yet there is nothing on the books to try and sort this problem out. We pride ourselves on being a first world country, so this level of government disassociation around our health system is not good enough. Nothing appears to be planned either to ensure that we have a workforce for aged care. There does need to be parity between those that are working in private rest homes and working in DHB rest homes. We all know that caregivers are absolutely essential in rest homes.
I recognise the honourable member, Dr. Paul